A very good evening to you, our viewer. Thank you so much for choosing Church of Uganda Family TV. This is a Tuesday, and we welcome you to our edition of Family Hour. Tuesday, we are always discussing family health, and it is very important that you know about your health. You mind about what you eat, you mind about your lifestyle as a family, because when that is managed, then you put your lives at low risks of acquiring some of these diseases. Today, we are discussing one of those silent killers. Of course, you know that hypertension is the most common cardiovascular disorder affecting approximately 1 billion people globally, and this is now approximately 9.4 million deaths per year. This is too much, and when it comes to the low developed countries like Uganda, it is even worse, that some of us live with hypertension in denial. We don't want to admit that we have it, or if we have it, we don't know that we have hypertension actually, because we avoid hospitals. We think they take our money. But it is important that, one, we know the lifestyle and what we need to do. That is why we are looking at nutrition and hypertension today. With us is Denis Musoga, who is the head of nutrition, Uganda Heart Institute. You're most welcome, sir.
Thank you, sir.
Kindly greet our viewers, and then we shall get into our discussion today.
Yeah, well, I celebrate you all in the name of our Lord Jesus Christ.
Amen.
Denis Musoga, like you heard, from Uganda Heart Institute.
Amen. It's a pleasure having you once again discussing this pertinent topic. But to start with, you know, when we talk about hypertension, it is a little abstract, and someone really want to understand what hypertension is, because it is something confusing.
Hypertension is basically having high blood pressure.
Okay.
Now, high blood pressure means that your pressure is high. I mean, it's beyond the normal. I mean, of course, when blood is moving within your vessels, it should move at a certain pressure. Now, if that pressure goes higher than what we expect, it becomes hypertension or high blood pressure. Yes, basically that's, in layman's language, that's what hypertension means.
Okay, so we know hypertension is high blood pressure.
High blood pressure, right, yeah.
Now, maybe we can look at how it comes about. Or what? Because I don't think it is inborn. I don't think it is genetic.
No, high blood pressure is one of those acquired diseases.
Okay.
Acquired diseases as a result of lifestyle, where there could be primary or there could be secondary to something else.
Okay.
You hear me? So, but one of the major causes is basically, lots of causes, right? But that is one of them. We have things like alcohol consumption is also one of them. We have things like cigarette smoking, or tobacco smoking is also one of them. We have things like abuse of drugs, drugs. Somebody abuses drugs, like especially drugs like cannabis or marijuana, that could cause high blood pressure as well. Stress is a key factor when it comes to causation of high blood pressure. Stress, very, very important. We have things like salt or sodium consumption. High sodium consumption is also one key factor that would cause a hypertension. And the other thing is poor dieting. A diet not rich in fruits and vegetables will cause hypertension. Obesity is one of them. If you're obese, your hypertension is one of the things you'll get when you're obese. If you're inactive, like inactivity is one of the things that would cause hypertension. Sometimes age would cause hypertension. As somebody ages grows older. That's why we need to be careful as we grow older. It can cause hypertension. Hypertension can be as a result of, it can be secondary to other diseases, like HIV, like diabetes, like other, kidney disease and stuff. All those would result to cause of hypertension. Yeah.
Okay. We now look at those are some of the causes that someone can look out for, but how can someone know before they come to hospital? Are there any signs or symptoms that someone can look out for, and then they see maybe because of this and this, I could be at a risk?
Hypertension. Well, we don't always recommend for people to wait out for symptoms, because by the time symptoms come, it's kind of late, it's kind of late. So the best thing would recommend is people to do health audit, do regular blood pressure checkups. You're hearing me? And as a matter of fact, we advocate every home, every family should at least own a blood pressure monitor. A digital blood pressure monitor, just to know, just to be in the know of how much your blood pressure is. So there are no symptoms to, by the time it gets to the symptoms, it's late. You're hearing me? But of course, some of the symptoms will be like headache, maybe palpitations, or maybe difficult in breathing, getting tired quickly, and stuff like that. But the most important thing is, before you come to the symptoms, it's important to check. Blood pressure in most times is asymptomatic. There are no symptoms at all. You're hearing me? There are no symptoms at all. So the best way to catch it, or to get it before it becomes too late, is to check. Do regular blood pressure checkups. Go to the hospital, and what has taken you there is to know your blood pressure. These are one of the things you should know. There are about three things you should know about yourself, and that is your blood pressure, that is your cholesterol levels, and that's your sugar levels. Very important. You should know them. Know them anytime, all the time. You're hearing me? So because blood pressure keeps on fluctuating, so many things make it fluctuate. Stress can make it fluctuate. Sometimes we have eclampsia, like blood pressure as a result of pregnancy and stuff like that. And you may not know if you don't check. You're hearing me? Sometimes it may shoot up and remain there. Sometimes it may shoot up and come back. So it's important to check, at any time, so that you're sure about your, like personally, I know my blood pressure. I know the ranges. So when it goes higher than that, even when the high is normal, our mind will be, no, this is not my blood pressure. My blood pressure is within this. You hear it? So it's important to check your blood pressure as often as you can, so that you're aware about the numbers of your BP.
Okay.
Yes.
You talked about the ranges. What should be the range of a normal blood pressure, and when should someone know that now this has gone beyond, so there is now a risk?
BP is measured in at 2 points. When the blood is leaving the heart and when the blood is coming back to the heart. So there's an upper part which is called the systolic, which is usually 120 or less than 120. The normal should be less than 120. Less than or equal to 120. And then the downward, which is the diastolic, should be about 80. 80 milliliters of mercury, 80. Okay. You get a point. That should be the norm. So if I said less than, there are people who will show up with less BPs, like mine is about 110 over about 70, or sometimes it's 100 over 70, and that's very normal, especially if you don't have the symptoms of low blood pressure. Okay. You hear, like arthritis, most arthritis will show up with blood pressure which is far below 120, over about 80. Below that, why? Because it's safer to have a blood pressure of 120 and below. You're hearing me? Especially if it's not, you don't have any symptoms of low blood pressure. You're hearing that, yeah.
Okay. And then what about the highest? What should, because you've said it is safer there. What about the highest? If someone is to have a normal high.
No.
If I can put it
well,
like
it
that.
can go up to about 130 over about 85, but if it goes beyond 130, so it's getting high. Okay. It's getting high. Even 130 is not good enough. You should worry why it's 130. You should bring it down to the normal. Because if you keep it on 130, after all, it's not very bad. It's not, it can escalate and go bad. So it's important to keep it between 120, at most 130,
Okay.
Yeah, basically.
Because we're looking at nutrition, we now want to relate nutrition, because you told us that diet is one of those causes of hypertension.
That's right.
We want to look at diet and how it causes hypertension.
They're very important. Very important. Every time we talk about hypertension, we can't exclude diet. Yeah, much as there are many causes like alcohol consumption, like cigarette or tobacco smoking. But diet is also very key. There's a diet called the DASH diet. we have about 2 important diets that somebody will take when they want to prevent themselves from hypertension. We call what called DASH diet, dietary approach to stop hypertension. Now, this kind of diet basically involves about 4 or 5 foods that somebody should take care of, and that is 1, sodium or salt. Salt, in other words, should be low, limited. Salt should be limited. I told you the last time I said that, so every time you increase salt increases blood volume.
Yes.
And when the blood volume increases, remember the vessels are remain the same, eventually the blood pressure will shoot up as a reason of the blood volume increasing. So salt should be reduced as much as you can. And how do you reduce salt? Number 1, don't add salt to your food. Number 1. Number 2, try to read on the labels. Read on the labels. When you go to the supermarket and you're picking a convenience food, take time and read on the labels and find out how much salt is in this kind of food that I'm buying. You see, the other important thing of how to reduce salt, don't add salt to some foods like avocado pear. If you're taking avocado, you shouldn't add salt in it. If you're taking a boiled egg, they've given you some boiled egg, don't check on salt. If you're taking on chips, don't check on salt. In other words, all this you're trying to reduce salt as much as you can. You hear him? Now, there are times you may need to exchange salt for some salts which don't have sodium in. Like, for instance, there's salt which has potassium instead of salt. You hear him? You could exchange that in an effort to reduce the sodium, being one of the causes of hypertension. So you could change and maybe do the herbal salt, or maybe the salt which is rich in potassium. Now, why potassium? Potassium is very key. And every time we're looking at prevention of hypertension, it's important that you take foods that are high in potassium. What does potassium do? Potassium, number 1, will help the kidneys to kick away or to excrete the sodium. You hearing me? And also, number 2, it kind of like helps the integrity of the walls. Like, it kind of like makes this wall strong and, reduce the tension placed on the walls of the vessels. And by so doing, the hypertension kind of like is avoided. So that's the beauty about potassium. So that's why sometimes it's important to exchange the sodium salt, or the salt that has sodium in, with salt that has potassium chloride. The salts which has potassium chloride or So the other way you can avoid salt is basically the things that I've told you. So that's number 1.
Yes.
Then the other food which is so key is increase the vegetables. Increase the vegetables. The fruits, increase them. Why? Number 1, they'll help you to check on the weight. You hearing me? Every time you're taking vegetables and fruits, you're literally taking in fiber. Fiber will give you high satiety, and by so doing, you're not taking a lot of sugars or a lot of curry foods, and thus hypertension will be avoided or gone down. But also, fruits and vegetables are high in potassium. Very, very high in potassium. You hear me? Your body needs potassium. Actually, averagely, an adult male needs about 3.4 grams of potassium every day. You hearing that? And an adult woman needs about 2.4 grams of potassium every day. And that can be gotten from fruits, like especially bananas, fruits like bananas. One banana has about 200 grams of potassium, which is so important. Avocado has potassium. So by increasing a lot of potassium, which can be gotten from fruits, you're strengthening your walls. Remember, you're improving the integrity of the walls of the vessels to fight off hypertension, and you're helping the body or the kidneys to kick away sodium, out, which is detrimental.
Yes.
Then the other food is oils and fats. Now, oils and fats are very, very key. One of the oils, every time we talk about oils, we have 2 categories of oils. We have the saturated oil, and that's basically animal-based oil, which is usually in cholesterol. Now, cholesterol is not bad, but when it exceeds the norm, it becomes terrible. The normal cholesterol level should be about 4 millimoles per liter for a person who has risk factors, or 5 millimoles per liter for a normal person. So when it exceeds by reason of taking in high cholesterol, eventually it will result to hypertension and other severe days. So it's important to endeavor that the cholesterol is low, and thus you should take foods that are very low in saturated fat, and those are basically animal foods, So meaning, if you're taking animal foods, like for instance chicken, trim off the fat. The skin part, take it off. If you're taking beef, get the fat off. If you're taking milk, dilute the milk. You hear me? Now dilute the milk. It's important to take milk. Some people will be like, but I was stopped from taking milk, or somebody told me to stop taking milk. Now, I personally don't stop my clients from taking milk. Why? Because of the importance of milk. Milk is so important. Actually, there's no stage in life somebody should stop taking milk. The most important thing is to modify it by skimming the fat content out of it. Boil it, skim off the cream, and then dilute it.
And how do you dilute it?
A ratio of 1 to 1. Okay. You see, milk is one of the cheapest source of calcium, and calcium is so important, even for your heart. You hear me? So don't stop with the milk. If you're scared of the cholesterol in the milk or the fat content, the saturated fat content in the milk, just boil the milk, skim off the cream, and dilute it to a ratio of 1 to 1, or go to the supermarket and buy skim milk or low-fat milk. You're hearing that? So that's how to reduce cholesterol. Animal fat should be, and then the other oil, which could be high in cholesterol, are unclear oil, an oil which is not transparent. Every time you look at an oil or fat that is not transparent in nature, it means that oil could be high in what? In cholesterol or saturated fat. So put it off. So when you're choosing oil, it's important to choose oils that are clear. You hearing me? Like olive oil. Actually, many studies have been done about the things. Like there's some study which was done around Italy and Spain called the Predimate study. The study was done by testing what they call a Mediterranean diet. They tried it on people who had risk factors. Adults of about 55 years old, about 7,000 of them. They tried them out by giving them 3 types of diet. To one, they gave them the Mediterranean diet with a lot of olive oil. You hear me? The type of oil I'm talking about, the unsaturated type of oil. And then the other, they gave them the Mediterranean diet with nuts. And the other, they gave them a normal diet. And to their surprise, the people who took these 2 diets, especially with olive oil, came out to be fine after some time. And the study took about 7 to 8 years. So these oils are so important. So when you're choosing oils, it's important to choose oils that are less in saturated fat. And these are basically plant-based oils, clear oils. And then the other important food is sugars. I told you last time that every time you take sugar, like you increase glucose in your blood. And the moment you increase glucose in your blood, you trigger off production of insulin from the beta cells of the pancreas. So they come in action to try to regulate the sugar in your blood. And by so doing, they turn the sugar to the fat, and then you become obese. And then before you realize your vessels are clogged, before you realize hypertension has come in. So basically, those are the foods people should really take care of. Of course, alcohol consumption should go down. Tobacco use should go down. Other factors like stress. Be happy. Why? Why shouldn't you be happy? You see, Edwin, life is tricky. You're not going to change everything in the world. Let go and be happy. Be happy. God wants your life. Yeah.
Okay. You talked about the fats, and you talked about the oils. Someone is concerned about the ghee.
Ghee, right? Ghee.
Where does it fall?
Now, amazingly, people love ghee so much. People love ghee so much. Of course, it makes the food palatable. Edwin, oils make food palatable. It's very hard to make food palatable without oils. You hearing me? And ghee is one of the oils that people love so much. Put in katogo and put in all the things. But
sometimes
unfortunately,
they even ask, did you put that?
Oh yeah. They go buy it and stuff like that. But unfortunately, ghee is a saturated fat. It has a lot of cholesterol. It's one of the things that is going to predispose you to a very, very high cholesterol in your body, in your vessels. That's the most unfortunate part. You're hearing that? Yeah, cholesterol is bad. And the challenge about cholesterol is that you'll not tell you have it until you run a test, which test people rarely do. You have to go in a hospital and do what they call a lipid profile to find out how much cholesterol is in your body. And people rarely do these things. Now, the other unfortunate part about cholesterol is what we call familial hyperlipidemia. Like familial in a sense is genetic. So you find a person like me with the right diet but with high cholesterol. So that's why people should really, really check out these things, The only cure or the only way you can prevent them is to first of all know if you don't have them. You hear me? You could be there and you think you're normal, and then boom, you have, the type of cholesterol which is familiar, like genetical, and before you realize you're hypertensive. They check you out. Haven't you seen, Edwin? Somebody's well-shaped,
Yeah.
And I mean, and he's young and he's hypertensive.
Yeah.
He's hypertensive, you know.
Sure.
So basically because of some of the things. And cholesterol is one of the things which would lead to hypertension unawares. Why? Because it doesn't pain, doesn't hurt, and then, yeah.
Okay. So, are there signs? Because I'm really interested in this cholesterol, especially the one you talked about, the genetic cholesterol. So, are there signs that someone can look out for, and then they know it could? Oh, you just go to the facility by error to try out to test and find out whether you do.
It should be everyone's habit to go to the hospital for a checkup.
Okay.
It should be everyone's habit, especially if you begin to age in life. To age. You hear me? You know, we have to accept the fact that we age.
Yeah.
You hear me? There's a time you're young, there's a time you're a teenager, there's a time you're an early adult, and then there's a time you begin to age. The moment you begin to age, 40, 50 years, it's important that you begin to take care of yourself. Otherwise, you'll die early. So the most important way of how to do this is to check out. Go to the hospital and then run a lipid profile, find out how much cholesterol is there, and then if it's high, it can be reversed. This is the beauty about checking these things quite early in life. You hearing me? Once they are caught early, they can be reversed by not doing so much, not even on medication. I mean, Edwin, we've reversed hypertension, this hypertension which is trying to come by reason of diet. By reason of that, somebody comes and then boom, the BP is kind of high. You look at them. Of course, you look at other factors. Somebody is 35 years old, is probably just slightly overweight. You hear me? Is active, is not diabetic, is not this. You hear me?
Yeah.
And then the BP is about 140 over about 85 or 145. So such a person may not need drugs. They may not need drugs, given the other factors which could be constant. You hearing me? The only thing about them is the BP is high. But the guy is well shaped, the guy is young, the guy is not diabetic, he's not a smoker, he's not a drunkard. So you don't shoot them on drugs. So you begin by look out how they're dieting. What do you eat? I eat like this, I eat like that. And then before you realize, the BP has gone down. You hearing me?
Yeah.
We also have other foods which are very, very amazing that have been known to reduce some of the things.
Oh.
Yes.
Okay.
Yes. Foods like celery. You've heard about celery?
Yes.
It's very amazing as far as...
And it is rarely consumed.
No, these things are down here in Nakasero.
Yeah, down here in Nakasero, but they're the least sold.
Well,
especially, they're the least bought by Ugandans.
It's Indians who buy them.
Yeah, exactly.
If you go down here in Nakasero, you'll find
They'll
Indians
tell you they sell them to
buy the
Indians.
things. Yes.
And Chinese.
Yes. Celery, very good. There is this flower called sadaba flower. These flowers, they're common in some homes. They have red, pink flowers and white flowers.
Yes.
You've seen that kind of flower. I wish we had a picture and show them out. Okay? These flowers, the leaves, if you boil the leaves and the liquid, you take that water in there, that boiled water. Very good for hypertension. Okay. You get the point? If you mix that, you mix you mix that kind of flour and then mix the celery, you put some oatmeal, you do some bitter gourd. You know bitter gourd?
Yeah.
Kalila, eh?
Yeah.
Kalila, that bitter thing. Very nice. The things can reverse some of these things, especially if they're gotten early. You hear, if the hypertension is beginning to come and there are no other risk factors, you're not an old man, you're an active man, you're not a smoker, you're not, and we do some of these things, boom, the BP will go back and you're normal.
Okay.
Yes.
Wow. We are taking a short commercial break, and when we return, we continue with our discussion. But the conversations also continue on our social media platforms, that is Facebook, Twitter, COU Family TV. So engage, you can send in your question, it will be responded to in the course. We are taking a short commercial break, we shall be back. We are talking about hypertension and nutrition, and like we said in the first part of this show, that it is a silent killer.
right.
Before you know, you're almost gone. And I think very many of us go to their hospitals when we are at the very last stage, because our guest told us that there might be no signs at when it is still young, if I can put it like that. But when we talk about hypertension, we know it is a silent killer, but someone would really be asking themselves, what is the prevalence in the country? Because we know these global statistics, and someone's, maybe those are these
it's countries.
Not yet here. It's not yet here. And then when we bring it to our country here,
right.
then we may know that. Yeah.
That's right.
Yeah.
Yeah, well, unfortunately, the hypertension is already here. It's already here. I mean, about, I think, 2016, Uganda Health Demographic Survey, that's about Ministry of Health, conducted a study, and their findings were like every 1 out of 4 adults is hypertensive. Can you imagine that?
1 out of 4?
4 adults. And an adult, you know who an adult is?
Yeah.
From 18 years.
Yes.
Yeah, every 1 out of 4 adults. That's about 25%
Yes.
of the current population. You're hearing that? So
That
if
is
you're
too much.
that's too much. That's too much. And what's even more worrying is that out of that percentage that is not that is hypertensive, almost 80% are not aware. You hearing me? And this we see quite often. We see every time we do an outreach. You hearing me? We do quite a number of outreaches as Health Institute. We go out in community and then run tests and then educate the people and stuff like that. So every time we go out in the community and try to do some tests and some checkups, surprisingly well, we get lots of people who show up very hypertensive and unaware. Somebody's walking by and then like, well, what are these guys doing? Like, well, they're running a test or they're doing some checkups, and then they come unawares. They didn't intend to come, and then they pass by. You do a checkup, you do their BP, and boom, 200 over 110, and you're like, you're sick. I'm like, but I'm not sick. You hear it?
No more everything.
So and then you try to be like, you're not going anywhere. Like, but I'm okay. You know, we've rested so many folks, in our outreaches who are severely sick but not aware. Now, those are the people you find, he's walking and boom, strokes out. Yeah. And you're like, wow, bewitched.
Exactly.
Bewitched. If you quarrel with the neighbor will be in trouble. You get the point? They'll be in trouble. Yeah. These are folks you hear, he died in his house. Yeah. He was driving and then boom, shut down and then collided with other cars head on. You hear him? Why? Because they had hypertension they were not aware about. So the thing is serious. It's serious in the country, very, very serious. Yeah, fortunately, Health Institute is opening up centers everywhere. And then there is this also lie that hypertension is amongst the rich.
Yeah.
Yeah, they think it's amongst the rich. No, it's not amongst the rich. I mean, from what we see in the communities out there, hypertension seems to be with everyone. 1 out of 4 adults, irrespective of your financial status, is sick of hypertension. So it's common in the villages, here in town, in Kampala, everywhere, people are sick. You hear it? So it's important that we fight the thing. Fortunately, it's easily, we can fight it out. We can fight it out by reason of doing the things we're talking about. We can totally eradicate hypertension, by the way. Yes.
That is the hope we have. Now we talk about, actually, in the break, someone was complaining about obesity. They say it is alluded that all people who are obese, if I can put it like, because I think obesity is also sometimes a perception of someone, but it is alleged that all people who are obese are hypertensive. Is it true? And how is our obesity related to hypertension?
Well, it's not true, but they could become.
Okay.
You hearing me? Obesity is a predisposing factor. The moment you become obese, you have something that attracts hypertension. You hearing me? Now, Eden, if you put something that stings terrible over there in the corner. Flies may not come.
Yeah.
You hear me? But what can bring them is there.
True.
So if you find the flies after a day, you'll not be surprised, will you? You hear me? Because you put what attracts them. So in the same way, if you're obese, you are going to be hypertensive. You may not be hypertensive now, but you are going to be hypertensive. That is it. That is it.
So what causes obesity in the first place?
Overeating.
What is overeating?
Overeating is eating a lot of sugars.
Okay.
And doing less exercise. We have what we call energy balance. Energy taken in, energy taken out. If you're taking a lot of calories, sugars, that gives you energy, and you're dissipating no energy, the result is obesity. You hear me?
Yeah.
But if you eat your calories and you dissipate them by reason of exercise, the result is that you'll be well trimmed. You hear me? Yeah. So what causes obesity is overeating. Of course, there are folks who are born, they have in their gene, there is this gene of the fat. You hear me? But that can also be exacerbated by poor diet. Even when in your gene there is a gene of obesity, it can be controlled by right eating. You get what I'm trying to say. Now, obesity, how do we know obesity? Obesity is measured by a parameter we call BMI, body mass index, where we get your weight, which is in kilogram over your height in meters, and we square it. So anything beyond 25 kilogram per meter squared is overweight. Anything between 25 and 30 is overweight. Anything above 30 is obese. Then we have obese grade 1, obese grade 2, and then obese grade 3. You hear it? But we also have folks who will step on that scale and it shoots so high, but when you look at them very, very critically, they have more of muscle. Especially these guys who mug. You hear me? The guy is all mugged up like this, with just, they call them six packs.
Yeah.
6 packs and stuff. And the guy steps on the scale and boom, the scale reads about 120. But the guy has no muscle. So when you calculate this guy's body mass index, it will definitely be high. Now, we don't call that obesity. And that's why, personally, the parameter I usually use to determine whether somebody's badly off is waist circumference. You hear me? The most dangerous fat is this fat around here. We call it central obesity. This is the most dangerous fat. Most of the vital organs are located here. The heart, the kidneys, the liver, all of them are around here. So when you accumulate fat here, you kind of like mess them up. You hear me? You kind of like mess them up. So basically, this fat around here, this fat around your stomach, ideally, every man should be flat. Every woman should be flat, and unless they're pregnant.
Okay.
Unless they're pregnant.
Okay.
you hear that? If you ain't pregnant, you're not allowed to have a pot belly. No, this is sickness. This is going to predispose you to a lot of challenges, syndrome X, which is that hypertension, DEM, and all that. You get the point. So it's important to be flat.
And sometimes people say if the tummy is protruding, then you should be doing well financially.
That used to be that back then, but people are getting informed now. It was as a reason of ignorance. You hear me? You can be well off and you're flattened. Yeah, it's possible. You hear me? It's very, very possible. So, obesity, to me, it's having a big stomach. You hear? And that's why usually I use the waist circumference. Your waist should be less than, for females, it should be less than 88 centimeters. And for male, it should be less than 102 centimeters. You hear? Your waist. So if it exceeds 102 centimeters for male, you're
obese.
You're obese. You have this obese. So you can't be fat everywhere. Like those guys who mug and then they step on the scale and the scale shoots up so high. You hear me? But they are flat. They have 6-pack. The guys are healthy. But the scale shot up so high. So I would rather that we use the waist circumference. You hearing me? Waist circumference. And like I told me, what causes obesity is overeating. A diet very high in calories, a diet low in vegetables and fruits, a diet you're basically low in fiber, low in vegetables and fruits, high in calories will result to obesity. You'll be obese. These guys will eat commando all the time. They'll be obese. These guys will eat chapati all the time. They'll be obese. White bread all the time. They'll be obese. White rice, you know, white posho, you know, white, refined.
Yes.
Refined. A lot of potatoes, Irish potatoes, you'll be obese. I told you last time that if your plate is round, divide it into 4 quarters. The first 2 quarters should be frozen vegetables. The other quarter should be sauce or protein sauce. And then the last quarter should be the carbs, the carbohydrate foods. Once you check the carbohydrate food, your weight will begin to reduce naturally and very, very smartly. You're hearing me? It can't reduce overnight because you didn't get it overnight. You didn't get it overnight. But if you check those foods that I've told you about, it will begin to get down naturally.
Okay.
Yes.
Well, let us look at the lifestyle choices that one should adopt, especially in the management of hypertension.
Wow. Number one, if you're hypertensive already, the doctors really tried everything else, and have diagnosed with hypertension, tried to bring it down by reason of diet and by reason of everything, the doctors most likely to give you drugs. You see, they will give you antihypertensive drugs. You see, once those drugs are given to you, those drugs are not supposed to be stopped. They don't stop them. You take them for life, and until your doctor maybe reduces them or changes them, but unlikely he'll take them away. Yes, there are those who are given the reason to why the hypertension came. The doctor may give them drugs for some time and then withdraws them. You hear, but that's rare. So number one, take your drugs as prescribed by the doctor, as prescribed. If he tells you take it twice in a day, take it twice in a day. Even when you're feeling well. Because one funny thing about hypertension is that once you take the drugs will begin to work. So your BP will normalize, and then you'll be normal. So there's a temptation for most patients to think that they're healed now, and then they'll stop the drugs. Hypertension, was diagnosed with hypertension, the chances are high that you may not heal, but it will be controlled. Okay. You hearing me? So, and by reason of drugs. The other important thing which will help you to manage your hypertension is be happy. Be happy. Don't stress. You hearing me? One funny thing about hypertension, you say hypertension releases cortisol, those stress hormones, adrenaline, catecholamine, those stress hormones. So eventually those hormones will boom and then shoot up the BP even when you're on drugs. So try to be happy. That's one of the things. You're hypertensive out there, and then your BP is challenging you despite the drugs. Try being happy. Wake up and laugh. Amazing. Just wake up and laugh, you know. Wake up and then begin to laugh. Begin your day by laughing. You don't have to get anything to laugh. Laugh. You hearing me? Then the other important thing once you're diagnosed hypertension is check your salt. Begin to cut down the salt as much as you can. Cut it down. Cut it down. By so doing, you'll be managing hypertension very well. The other thing is begin to eat lots of fruit and lots of vegetables. Eat the vegetables as much as you can. Eat the vegetables as much as you can. If you're obese and you've been diagnosed with hypertension, it's important that you cut the weight. Cut it. Try to cut it as much as you can. Now, there is a challenge. I've received many clients who come to me and told me, we do some weight loss program and we switch them on exercise, and then what happens with them, the weight doesn't change, but they come back reporting that they're lighter. They come back reporting that their tummy is kind of, the cloth that used not to fit them by reason of being small, they're now fitting them, but the weight has not changed. No, well, that can happen because sometimes when you do exercise, muscle builds up, and muscle is equally heavy. You're hearing that? So the muscle builds up, the fat's cut down, so the weight remains, but you've cut. Because what we're looking at is the fat to cut down and the muscle to build up. You're hearing me? Every time the muscle builds up, it's for your advantage. You get the point. Then the other thing about, avoid snacking. Avoid these snacks, oils and fats. Avoid it. Avoid it. Do exercise. Eat a lot of fruits and vegetables. I mean, And by sodium, your hypertension. We have folks who have been hypertensive for the last 30 years, last 40 years.
Really?
Yes, you can be hypertensive for life as long as you do take care of yourself very, very well. Take your drugs, eat appropriately, be happy. You're hearing that? Stop the alcohol, stop the smoking, keep away from smokers. You know, you'll be hypertensive and it will be there. Controlled. Controlled. You hear me? Controlled. But don't you be tempted to leave your drugs because you may think you're healed. No, you're not healed. The drugs are just working. The pressure is just being controlled. Yes.
Okay. That was for someone who is hypertensive. What about someone who maybe they have checked and their system is still normal? What can they continue doing so that they do not get hypertension?
Now, if you do check, and of course 75% of the population is not hypertensive. So meaning majority of the people we have in the country not what? Hypertensive, according to the research they did a few years back. So what do you do when you turn hypertensive? Do almost the same thing. Keep doing the exercise. Don't grow obese. Don't take those fads. Be happy. It's usually the same thing. It's usually the same thing. But importantly, keep on checking. Check every 6 months. As you grow older, reduce the time of checking. If you used to check every once a year when you're in your 30s, when you get to 40s, do it twice a year. When you get to 50s, do it like maybe 3 or 4 times in a year. When you get to 60s, do it quite often. You know, check as you age. Check quite, because when you age, everything about you ages. Your vessels will age, everything will age. You hear me? So it's important to and also adopt. Learn to visit nutritionists. Learn to visit nutrition. You know, when you come to me, Adrian, one of the things I'll ask you is that, what's your age? You tell me. What's your medical history? You tell me. What's your activity? You tell me. So I'll lose all those parameters to design for you a diet suitable for you. You hear me? If an old person who's about 80 years comes to me and they tell me about their medical history, how they've been dieting, I will not give them the same prescription I'll give a 30-year-old. I'll not give them the same prescription I'll give. So basically, diet changes according to so many things: your activity or your kind of work, your income, your tastes and preferences, your medical history, your age, you know, the drugs you're on. So many things we look at to design for you a diet appropriate for you. So there's no such a diet as one fits all. We may have some general things, right? But people are different. People are very, very different. So subjecting the same diet to the same people is kind of detrimental, and it's not right. Okay. Yes.
Lastly, we talk about people who love pork and some other fatty meat. How should they eat this this meat so that it doesn't expose them to hypertension?
Pork, pork is a very serious delicacy for most folks, especially the Christian folks.
Yeah, sure.
Yeah, I don't know. I think that's one of the things that makes them happy.
Maybe.
Yeah, it's if you went to Lugogo right now, you're shocked. You'll find hundreds of people there.
Exactly.
Of course, all of them are Christians. Yeah. It's rare that a Muslim will be there. Lugogo, that you know, everybody picking a stick and stuff. Now, pork is white meat. There's the thing like a white meat. White meats are good. But yeah, well, it's white, but pork is very high in cholesterol. Very, very, very high in cholesterol. Very, very high in cholesterol. And then of course, we told you about how dangerous cholesterol is. The moment it exceeds 4 millimoles per liter, it's terrible. It's terrible. So pork is one of the things that will predispose you to high cholesterol. You hearing me? So don't you take pork as often. Take it once in a week, but not every day. When you're eating, don't eat like you're not eat the next day. You hearing me? Some folks eat like a kilogram, one person. That's terrible. That's terrible. I mean, that's greed, by the way. That's being a glutton. Eat like you're going to eat the next day. Eat like that's not your last time of eating. Eat a little so that even tomorrow, the other day, you can eat some. So eat little, reduce pork. And the other challenge about pork is most pork eaters take it along with beer and some alcohol. And then that's also terrible. That's also terrible. So pork should be limited to about once a week. And of course, when you're eating it once a week, also the quantity matters. Don't eat a kilogram. Don't eat half a kilogram. Eat a few pieces. Eat a few what?
Pieces.
A few pieces. Yeah.
Okay. As we wind up this discussion, what are your closing remarks on this subject? And your general remark.
My general remarks, of course, maybe in substitution for pork, people could eat fish.
Okay.
Yeah, fish. You go and take deep fried fish. Yeah, deep fried fish is good. I mean, it's rich in omega-3 and omega-6, you know, and omega-3 has been known to counteract the effects of cholesterol. You see, when you take fish, quite often, you know, instead of eating pork, eat fish. That one you can eat every day. There's no problem with that. Okay. Yeah, go down and then take deep fried fish, or especially if it's deep fried in right oil. If it's deep fried in right oil, in maybe olive oil, sunflower oil, or sunset oil, and then eat the fish. Eat the fish quite often. The oil in the fish is good for your heart. It's very rich in omega-3, which is going to fight off the cholesterol you're hearing. But generally, love yourself. Love yourself. You're hearing, love yourself. Hypertension is real. 1 out of 4 adults is hypertensive. It's killing lots of folks. It's terrible to find young people as young as 35, 40 years showing up with hypertension by reason of poor dieting. Eat appropriately. I mean, don't eat like that's the last time to eat. You know what surprises me, Adrian, is that now when we have about 3 major meals. We have the breakfast in the morning, we have the lunch, and then we have the dinner in the evening. But what surprises me is that somebody eats lunch like as though they will not eat dinner, like as though they will not eat the next day. I mean, this is food that you're going to pass out. You hear it's going to be broken down, and then the body gets what it needs, and then the rest will be excreted out. You hear me? So don't you eat like that's your last time to eat. Eat what suffices. You hear me? Eat, if you have plenty of food, give out. There are folks, you know, there are folks who lack food. True. Especially in Africa here. Yeah. You see, there are folks who lack food. Give out the food. You mean? Give out the food if you have plenty of food. But don't you kill yourself by reason of food. Don't eat like that's the last time you're eating. Don't eat like you're seeing food for the first time. You hear me? You know, you go to parties and somebody is having a... No, don't eat like that. You're killing your body. You're really, really killing your body. Yeah, that's my message to people listening to us.
Thank you so much, Denis. And it is really a powerful message because when it gets to food, there is a way people tend to be excited. But thank you so much for this discussion, because it is really very important that we pay attention to some of these things, because it is cheaper to prevent, but very expensive to treat. Therefore, it is important that we pay attention to the preventive measures so that at the end of the day, we are healthy. Some things might look a little hard, but it is all about lifestyle. When you get used, they become even more easier. Thank you so much for watching today's episode of Family Health, where we discuss health. And the whole of this month, we are with Uganda Heart Institute, talking about the heart, talking about cardiovascular diseases, talking about things to do with your heart life, and everything. So we meet again next week, Tuesday.
Maybe, Edwin, I hear somebody asking about children. Yeah, what about children? Should children do the same things? Where we've done outreaches in schools, especially primary schools and secondary schools. It's important that kids learn these things quite early. True. You hear me? Well, they may not do them like 100%, but it's important they learn them quite early. When they learn them quite early, as they age, they may start putting them into what? Into practice. You hear me? Into practice. Because, Edwin, you'll bear me witness, there's schools you go to and you find kids that are obese.
Yes, true.
Obese. And what's surprising, people associate them with coming from rich homes.
And parents are happy the school is taking good care of them.
Yeah, the school is taking good care of them, and you know, I don't think there are lots of schools that give fruits and vegetables to children.
If they're there, there are few.
At least I know one of them that does that.
Okay.
Give fruits and vegetables to their kids, every day. But not many schools do that. But our kids should be taught that our plate should be having fruits and vegetables at the same time.
Okay.
And by so doing, if this practice keeps on, if it's picked up early in life and kids grow with it, then we shall have a better future. You hear me? The reason why we call it things lifestyle, it's difficult to drop. Like for instance, Edwin right now, if I told you to eat frozen vegetables every day, half of a plate, man, it will be hard for you.
Yeah.
Because you've not done it for a while. You hear me? But if you started doing that way back when you're like 5 years or 6 years or 7 years, it will be part of you.
True.
You hear me? It will be part of you. You hear? But right now, Edwin, your plate, I'm sure your plate is full of calories.
Yeah.
And then small sauce and rarely a fruit and vegetable. You're hearing that. And that's how you've been and that's how it goes and so that's how it will be. But it's important that we change this even as kids. Even as kids. So if we do this early in life, in our homes, we need to stop this habit of eating randomly, even home. Have a menu at home. Have a menu in your kitchen. You hear me? A well-balanced menu from an expert who has designed it for you. You hear me? And cook according to the menu. You hear me? Put whatever the dietitian told you. Eat the fruits and eat according to the menu. Don't eat randomly. What are we eating today? So somebody wakes up. What do you think we should eat today? I think let's eat potatoes. Let's eat potatoes. That's how Ugandans are, and that's very dangerous. That's very dangerous. Have a menu in your kitchen and try to follow what the menu says, and boom, you'll be healthy. Yes.
We are grateful, and it is indeed very important that we pay attention to some of these things. Yeah, tomorrow is Wednesday. We shall be discussing family finances. For now, good night. God bless you. We'll meet again.
God bless you.